Assalamualaikum warahmatullahi wabarakatuh. My name is Ahsan Shah. I'm a hematologist oncologist practicing in Fort Myers, Florida. Um, that's it.
So the beauty of Jamaat and having people like Dr. Ahsan Shah is that I was pulled into a case at Tahir Heart that there's this young gentleman. He's the vice nazir of some Jamaat office in Rabba, and he has a thyroid mass, retrosternal. So, Dr. Saab, can you just please come into the OR with us and just help us take this thing out? And I knew nothing about this patient. So the good thing was that I was told about it a day before. So they said, well, there's a small chance you might have to open the sternum. I'm like, okay, where is the CT scan? Where's the mass? What am I dealing with? This is cancer, something else. So after I looked at the CT scan, it was obvious that it was something bigger than what I should tackle. And I'm not a cancer surgeon. I'm a heart surgeon. So yes, I do sternotomy for heart surgery, but that does not mean I can do cancer surgery as well. It's different principles involved in cancer operations. So at that time, I was introduced to Dr. Saab through the AMMA network and the AMMA Brotherhood. So I just messaged him and he was quick to respond to help out. I sent him the images and the test results, and he responded back. And I was still nervous going into the OR, so I asked him if he would have me talk to his surgical oncologist, the surgeon who actually does these operations. And he was kind enough that he put his surgical colleague on the phone with me, and when we went over different principles of how to resect this mass and what to do, and really put me at ease. And alhamdulillah, next day, this gentleman had it was a thyroid mass that was growing into the chest. So we did a neck incision, and it was a little bit of a bear to get it out. And at one point, I was obviously doing it with a general surgeon there. We were like, we have to do sternotomy to take it out. But then he and I put both of us put our fingers behind it. We had dissected it around down to the mid sternum through the neck incision, and we just yanked on it, and it just popped out. And the general surgeon you should have seen the happiness. They said, "Doc, this is great. You pulled it out." I said, "I didn't do anything. I just pulled on it, and you pulled harder, so it came." So, but he was very happy that we didn't have to do it, and mashallah, later on, the person ended up getting more therapy, and he did very well from this. So, jazakallah, Dr. Saab, for his help on that case.